It's all covered in today's China Truths.
The Chikungunya fever outbreak in Guangdong has spiraled out of control, spreading across 13 cities in the province. As of the early morning of August the 3rd, over 7,000 people had been infected. One area in Guangdong issued a notice on chikungunya sequelae, emphasizing that there is no specific cure. Online reports indicate that some hospitals have tightened security, only allowing those with fever to enter with a negative nucleic acid test result. Recently, the chikungunya virus spread from Foshan, Guangdong, to surrounding areas, prompting authorities to launch a massive campaign to prevent further transmission. Foshan has reinstated nucleic acid testing, travel registration, quarantine, and blood tests. Those who refuse to comply will be fined and have their electricity cut off. Guangdong authorities have deployed a large number of grassroots personnel to forcibly carry out mosquito control operations at homes, and many areas in Guangdong have designated low, medium, and high-risk zones. This has been criticized online as another COVID-19 style lockdown, suggesting the Chinese Communist Party government is only capable of such responses. Chikungunya fever outbreak in Guangdong rise to 7,316 cases. Taiwan's Liberty Times reports that the chikungunya outbreak in Guangdong province, China, continues to spiral out of control. From midnight on July 27 to midnight on August 3, 2,892 new local cases of chikungunya were reported in the province, bringing the total number of cases to 7,716 this year. Peng Yanghui, attending physician in the infectious disease department at Foshan Second People's Hospital in Guangdong province, revealed that most chikungunya patients admitted to the hospital have mild symptoms, and their conditions are generally resolved upon discharge. However, a small number of patients may experience mild joint pain for 1 to 3 months or up to 18 months. The U.S. Centers for Disease Control and Prevention, CDC, has issued a Level 2 travel advisory for chikungunya in Guangdong province, China, urging travelers to take enhanced preventative measures such as using mosquito repellent, wearing long sleeves and long pants, and staying in areas with screened windows to prevent mosquito bites. A Guangdong province issued a notice regarding the sequelae of chikungunya fever. CCTV News reported that from 008 on July 27 to 24 Hunt on August 2, 2,092 new local cases of chikungunya fever were reported in Guangdong province, with no severe cases or deaths. The cases were located in Foshan, 2,770 cases, Guangzhou, 65 cases, Dongguan and Zhongshan, 11 cases each, Shenzhen, Jiangmen, and Zhaoqing shared 6 cases each, Meizhou, 5 cases, Zhuhai and Huizhou, 4 cases each, Chaozhou, 2 cases, and Yangjiang and Yunfu, 1 case each. According to China News Service, on the evening of August 2nd, the Sanshui Public Security Bureau in Foshan, Guangdong, issued a notice regarding the sequelae of chikungunya fever. Chikungunya fever is an acute infectious disease transmitted by Aedes mosquitoes and has no specific cure. Symptoms of infection include persistent high fever, above 39 degrees, severe joint pain, and rash. Some patients may even develop chronic pain or serious complications, severely impacting their health and quality of life. Guangdong province is currently conducting a concentrated mosquito control campaign. According to Guanxia.com, in an effort to achieve immediate results, urban management authorities have released over 5,000 mosquito-killing fish, supposedly designed to eat mosquitoes, into some water bodies in Foshan. Every evening at 6 p.m., households in Huangpu Town, Zhongshan City, gather to light mosquito coils. Disinfection and biological control measures are being implemented in many locations to combat the spread of Aedes mosquitoes. Guangdong netizens commented, "Why does this feel a bit like COVID-19? It feels like COVID-19. It's much more serious than COVID-19. And if you didn't know, you'd think it was AIDS. It's so similar." Others said, "Okay, I'm stockpiling water and bread now, and I don't know if the mosquitoes have been killed, but it feels like we're about to be wiped out." A Guangdong hospital reportedly has security guards stationed, and only those with fevers are allowed to leave if they test negative. On August 1st, a video circulated online, filmed by a Guangdong netizen, showed that anyone with a fever in the hospital was locked in a small room for nucleic acid testing, primarily for chikungunya and dengue fever. There's a security guard guarding here, and they're not allowed out until the nucleic acid test results are negative. In response, netizens commented, "The communist bandits are deliberately creating an atmosphere of terror, looking for an excuse to once again lock down over 1 billion slaves." The CCP's goal with nucleic acid testing is control, from controlling individuals to controlling entire societies. This is the most ruthless means of maintaining stability. In a normal country, the bandit government would have been overthrown 180 times. Reviewing the epidemic, on July 8th, Shunde District, Foshan City, Guangdong Province, first discovered a local outbreak of chikungunya fever, imported from abroad. However, on the 15th, officials reported over 400 cases in the district. The outbreak then spread to all 5 districts of Foshan, 11 cities in Guangdong, and even to Macau. While Beijing officials acknowledged the occasional presence of imported cases, online rumors circulated that Beijing had reported local cases. Due to the CCP's consistent lies, the outside world widely questioned the official data. The epidemic in Foshan is severe. A local netizen who is under quarantine shared that they are on their 4th day of isolation for chikungunya fever. "My joints are no longer painful, my fever is gone. I've taken Chinese medicine and today's blood test turned negative. Negative nucleic acid tests allow discharge." Medical staff and safety inspectors are working 24 hours a day to fully control the spread of the virus. Videos show that the rooms in the suspected isolation hospital are already full, with mosquito nets covering each bed, and multiple police officers are present in the lobby. A Guangdong netizen commented that when the number of infections was initially low, quarantine was free, but as the number of cases increased, everyone had to pay for it themselves. Mainland netizens lamented in the comment section, "Just got back from Guangzhou. I went to Baiyun Mountain. My legs are covered in bumps. When I scratched them, they turned yellow. It's been over a week and they're still sore. My husband got itchy a month ago and has a rash all over his body. These past few days, my whole body has been itching for no reason, and I've been scratching all day long." U.S. and Hong Kong issue travel warnings. On August 3rd, Hong Kong physician Huang Xuan posted on his Facebook fan page to remind Hong Kong residents that dengue fever, malaria, Japanese encephalitis, yellow fever, and Zika virus are all mosquito-borne diseases. Currently, there is no specific treatment for chikungunya, and it can only be managed with supportive therapies such as fever reduction and hydration. Yuan Kwok-young, Chair Professor of Infectious Diseases at the Department of Microbiology at the University of Hong Kong, also recently warned Hong Kong residents to avoid non-essential travel to Foshan in the near future. Ao Kawing, Director of the Communicable Diseases Division of the Hong Kong Center for Health Protection, told the media that mosquitoes carrying the virus can transmit it to humans as quickly as 2 days after biting a carrier, and second and third generations of infection will soon follow. With hundreds of thousands of people traveling between Guangdong and Hong Kong each week during the summer vacation, the risk of chikungunya spreading in Hong Kong is high. He urged Hong Kong residents planning to travel to Guangdong, Hong Kong, and Macau to take effective mosquito prevention measures. The U.S. Centers for Disease Control and Prevention, CDC, raised its travel advisory for China to level 2 last Friday, the 1st, advising Americans to avoid non-essential travel to affected areas in China. Travelers planning to visit China should strengthen preventive measures against chikungunya. According to Deutsche Welle, WHO experts warned that WHO medical officer Diana Rojas Alvarez mentioned at a press conference that the chikungunya epidemic spread from a small island in the Indian Ocean to the world, affecting nearly 500,000 people. Just like 20 years ago, the virus is now spreading further to Madagascar, Somalia, Kenya, and other countries, with outbreaks also occurring in Southeast Asian countries like India, Sri Lanka, and Bangladesh, Alvarez said. He urged countries to remain vigilant and avoid repeating the mistakes of 20 years ago, when chikungunya spread globally on a massive scale. Severe floods hit Fujian, collapsing houses and destroying bridges. On August 1st, severe floods struck several parts of Fujian. Flash torrents tore through residential buildings, demolishing houses and bridges, sweeping away vehicles, and flooding farmland, causing heavy losses for the victims. On the same day, heavy rains hit Bangtu Town, Shanyu County, Fujian Province, triggering unprecedented flooding in Wudian Village and Nangxi Village. Video footage showed muddy flash torrents surging through the town, turning streets into rivers, completely submerging first-floor residences and businesses, and sweeping away cars. Some old houses collapsed in the floodwaters, leaving debris strewn everywhere after the water receded. Many homes were in ruins, with muddy floors and furniture and appliances destroyed by the flood. Videos also showed flooding in Dahua County, Guangzhou City, Fujian Province. The city was inundated, roads turned into torrents, and vehicles were submerged. Some people riding electric bikes fell and were swept away, while others waded through thigh-deep water. A netizen posted a video claiming that the torrential rain in Jiawan County, Guangzhou City, Fujian Province, was truly terrifying. The video showed streets completely submerged in floodwaters, like a raging river, with vehicles navigating the torrent like boats. The floods destroyed bridges and farmland, collapsed some homes, and swept away vehicles, causing heavy losses. A video showed that after the floodwaters receded, a section of farmland in Bangtu Town was completely destroyed, and rice paddies awaiting harvest were buried in silt, leaving no crops unharvested. On August 3rd, a disaster victim posted a video claiming that Bangtu Town had been flooded for 3 days, with many areas still under deep water and strewn with mud and debris. With no water or coal, some elderly people were unable to cook, and food delivery services were unavailable, leaving them starving.
Please share your thoughts in the comments section below. We will keep reporting on the COVID surge in China, so don't forget to subscribe to our channel and turn on the notification bell to get the latest videos. And thank you for tuning in.